the BRCA gene is a mutation we talked a little bit about earlier. BRCA1 and 2 mutations um, basically is a different chain of mutations in the DNA. And we've learned through the past couple of years that this particular mutation predisposes somebody that's a female to having a greater chance over their lifetime of developing breast cancer, in many cases early in life, so in the 20s and 30s. It can also predispose somebody to having ovarian cancer. And for males, for example, the average chance of a male getting breast cancer over his lifetime is about 1%. Males that carry the BRCA1 or 2 gene have about a 6% chance of developing breast cancer over their lifetime. So that's a pretty significant increase because of that particular mutation. It also increases the chance of prostate cancer and certain types of skin cancer. So it got a lot of press because of Angelina Jolie, if you remember. That was in the news in a very big way. Her mother actually had passed away from ovarian cancer. And when Angelina was found to carry that gene, she had a prophylactic mastectomy to prevent that from happening in her breasts. Now, the problem with that is there's no clear line of delineation in a breast that says this is breast tissue and then this is just normal muscle tissue or muscle fat that occurs in a chest wall. So although it wasn't a bad thing that she made that decision, it's not going to guarantee she's not going to get breast cancer over her lifetime. And then, of course, it doesn't address the ovarian risk that she has or the skin cancer risk that she has. So it tends to be a lot in the press, but it's just one of the many mutations that somebody can carry as it relates to DNA damage and a predisposition to cancer. Um, it's also one of the mutations that can actually be carried and passed down from generation to generation. So that's why it's not an acquired mutation. It's a mutation that most people actually have that's carried down from generation to generation.